Hello, my name is Abby Gross, and I'm a medical student at Case Western Reserve University School of Medicine. I'd like to thank the Pediatric Trauma Society for the opportunity to present. Today I'll be discussing emergent mental health visits among pediatric survivors of interpersonal violence. Trauma and mental health are leading causes of morbidity and mortality among school-aged children. Multiple previous studies report a positive association between exposure to interpersonal violence in childhood and multiple mental health outcomes, including suicide, non-suicidal self-injury, and substance use. These studies rely predominantly on patient self-report of historical trauma. They focus predominantly on outcomes in adulthood or late adolescence, or they focus on one mental health outcome. Therefore, the aim of this study was to evaluate the association between all forms of interpersonal violence and all emergent mental health visits among a pediatric cohort. In order to do so, we performed a retrospective cohort study at an urban pediatric level 1 trauma center. Our study population included youth aged 6 to 15 presented to the Rainbow Babies and Children Emergency Department in 2016 for a violent injury. Violent injuries were identified by ICD-10 codes. If upon further chart review, the injury was determined to be accidental, this patient was not included in the analysis. Of included patients, charts were reviewed from 2009 to 2019 for any additional emergency department visits for emergent mental health concerns or interpersonal violence. We identified 232 patients who presented to the Rainbow Babies and Children Emergency Department in 2016 for a violent injury. Among this cohort, 54% were male and 90% were Black or African American. 30.7% of these patients presented for an emergent mental health visit within the study period. The most common chief complaint was suicidal ideation. Notably, 73.9% of patients experienced at least one instance of interpersonal violence prior to their first emergent mental health visit. The total rate of re-injury for the cohort was 33.9%. However, this varied greatly based upon emergent mental health visits. Patients with 0 emergent mental health visits had a rate of re-injury of 25.6%. This increased to 50% with 1 emergent mental health visit and increased to 74.2% in patients with 2 or more emergent mental health visits. In conclusion, emergent mental health needs are common among pediatric survivors of interpersonal violence. Pediatric trauma survivors with comorbid emergent mental health needs are at increased risk of re-injury. Therefore, mental health services should be included in pediatric hospital-based violence intervention programming.